Hello guys, in today's video. Thanatophobia is a type of phobia characterized by fear of one's own death or the process of dying. It is commonly called the fear of death. Fear of death is not defined as a disorder, but may be associated with other depression and anxiety disorders. These include post-disturbing pressure disease or PTSD, panic disorder and panic attacks, disease anxiety disorder formerly called hypochondria. In this content, we take a closer look at thanatophobia, or fear of death, and explore the symptoms, causes, and treatments for this fear. Before we continue to our topic, do not forget to like, subscribe and hit the bell button. Brought to you by Psycho Geek. What is thanatophobia? In Greek, thanatos means death and phobos means fear. Thanatophobia is therefore translated as fear of death. A little fear of death is a perfectly normal part of being human. However, for some people, thinking about their own death or dying process can lead to intense anxiety and fear. Given the inevitability of death, a person can experience extreme anxiety and fear. You can also experience fear of breaking up, fear of dealing with loss, worry about leaving loved ones behind. In extreme cases, these emotions can prevent people from going about their daily lives or even leaving their homes. Your fears are focused on things that can lead to death. Contaminated or dangerous objects or persons. Symptoms and diagnosis. According to the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, phobias are anxiety disorders associated with specific objects or situations. Fear of death is considered a phobia if the fear happens every time a person thinks about dying, lasting more than 6 months, interfering with daily life and relationships. The main symptoms that a person may have a death phobia are immediate fear or anxiety about dying or the process of dying, panic attacks that can cause dizziness, flushing, sweating, and an increased or irregular heart rate. Avoid situations that might require you to think about death or dying. Stomach pain when thinking about death or dying. Common feelings of depression and anxiety. Symptoms can appear and disappear throughout a person's life. People with a mild fear of death may experience increased anxiety when thinking about their own death or the death of a loved one, if he or his family is seriously ill. If the fear of death is associated with another anxiety or depressive disorder, the person may also experience certain symptoms related to the underlying disorder. Causes and types of thanatophobia. A phobia is often triggered by a specific event in the past, but the person does not always remember what it was. It may be an early traumatic event. People suffering from a serious illness may experience thanatophobia because they are afraid of dying, but they don't have to be ill to experience this fear. The experience of fear of death depends on individual factors. These include age. A 2017 study found that while older people fear the dying process, younger people are more likely to fear death itself. Sex. A 2012 study found that women are more likely than men to fear the death of a loved one and the consequences of that death. Thanatophobia can be associated with specific phobias, panic disorders, illness anxiety disorders. Overcoming thanatophobia. A social support network can help protect a person from the fear of death. Some people accept death because of their religious beliefs, while others perpetuate their fear of death. People with high self-esteem who believe they have lived healthy, fulfilling lives are less afraid of death than others. Doctors may recommend that people with thanatophobia seek treatment for an anxiety disorder, phobia, or the specific underlying cause of the fear. Treatment includes some form of behavioral or talk therapy. This therapy tries to teach the person to refocus and process their fears by talking about their concerns. Treatment options for fear of death include the following. Cognitive behavioral therapy, CBT. Cognitive behavioral therapy, CBT, works by gently changing a person's behavior patterns so that they can develop new behaviors and ways of thinking. Doctors can help people find practical solutions to overcome their feelings of anxiety. They can work to develop strategies to stay calm and fear-free when discussing and thinking about death. Psychotherapy. Psychotherapy, or talk therapy, involves talking about your fears and concerns with a psychologist or psychotherapist. These professionals help someone identify the source of their anxiety and develop strategies for dealing with anxiety that arises throughout the day. Sometimes just talking about your fear can help you get more control over your anxiety. Exposure therapy. Exposure therapy works by helping people face their fears. Instead of burying your feelings about death or refusing to acknowledge your worries, you are encouraged to face your fears. Therapists use exposure therapy by gradually exposing people to fear in a safe environment until the fear response subsides and the person can face their thoughts, objects, or feelings without fear. Medications. Anti-anxiety medications may be prescribed when a doctor diagnoses someone with certain mental illnesses, such as generalized anxiety disorder, GAD, or PTSD. This may include beta blockers or antidepressants. Drug therapy is often most effective when people use it alongside psychotherapy. While medications can help relieve feelings of panic and stress in the short term, long-term use of such medications may not be the ideal solution. Provides long-term peace of mind. Relaxation techniques. Practicing self-care can be effective in improving your overall mental health, including feeling better about dealing with your fears. Avoiding alcohol and caffeine, getting a good night's sleep, and eating a nutritious diet are just some of the ways you can take care of yourself. When a person struggles with anxiety, certain relaxation techniques can help clear the mind and reduce fear. Practice deep breathing. Focus on specific objects in the room. Count the tiles on the wall. Meditation or concentration on positive images. It's natural to worry about the future or the future of your loved ones, but if the fear of death persists for more than 6 months or interferes with your daily life, it may be worth seeing your doctor. There are many ways a person can overcome their fear of death, and a psychiatrist can provide guidance and reassurance in this process. Thanks for watching. See you on our next topic.